Hello everyone, my name is Lindsay Inanas, and today I will be talking to you about GHB addiction. What is GHB? GHB is a central nervous system depressant that is commonly referred to as club drug or date rape drug. Common user groups include high school and college students and rave party attendees who use GHB for its intoxicating effects. This drug is also known as Liquid X, Georgia Homeboy, Mills G, Liquid G, along with a few other names. GHB is a powdered substance and is generally dissolved in a liquid. In liquid form, GHB is clear and colorless and slightly salty in taste. So GHB is highly addictive, but some consume it because it is euphoric and libido boosting. So it kicks in about 15 to 20 minutes after taking the drug, and it produces an alcohol-like buzz without the calories or the next day hangover. GHB is also commonly used as a recreational drug, particularly among partygoers on the club scene. GHB is very dangerous, and prolonged use can result in physical and psychological addiction, and terrible withdrawals categorized by the symptoms of insomnia, anxiety, tremors, sweating, loss of consciousness, nausea, hallucinations, amnesia, and among other side effects. In 1990, the Food and Drug Administration issued an advisory declaring GHB use unsafe and illegal except under FDA-approved physician-supervised protocol. In March 2000, GHB was placed in Schedule 1 of the Controlled Substance Act. GHB abuse became popular among teens and young adults at dance clubs and raves in the 1990s. And gained notoriety as a date rape drug. GHB is also a natural occurring metabolite that is found in the brain, but at much lower concentrations than those levels found when the drug is abused. As a result of fermentation, natural GHB may also be found in small but insignificant quantities in some beers and wines. Emergency room physicians may be unaware that GHB has been abused when a patient presents to the hospital. Therefore, due to the short half-life of the drug, detection in the urine may be difficult. Supportive care and keeping airways open are the primary measures used in the emergency overdose situation. When produced in-home or on the streets, the production of GHB usually involves the use of lye or drain cleaner mix with GLB, a chemical cousin to GHB, and an industrial solvent often used to strip floors. GHB is also a naturally occurring metabolite found in the brain. Recreationally, GHB has also been marked illicitly as an alternative to steroids for bodybuilding and for weight control. Clinically, the drug is useful for the treatment of cataplexy, and that happens when your muscles suddenly go limp or significantly weaker, and this might be triggered by a strong emotion or sensation, sometimes crying or laughing or feeling angry. And therefore, this drug is used to treat that. Combined use with alcohol, other sedatives or hypnotics, and other drugs that possess CNS depressant activity may result in nausea, vomiting, and aspiration, and dangerous CNS and respiratory depression. Illicit doses are typically 2 to 4 grams, and the onset of action is rapid, occurring 15 to 30 minutes following oral ingestion. So in terms of metabolism, roughly 95% of GHB is metabolized in the liver, and its half-life ranges from 30 to 60 minutes. Only 5% of that parent drug is excreted via the kidneys, Detection of GHB in the urine may be difficult after 24 hours due to its short half-life. When it was first used clinically in the 1960s, the central nervous system depressant GHB seemed to hold promise as a fast-acting anesthetic agent. Unfortunately, the addictive drug lacked any pain-killing properties and also tended to trigger seizures. The medical community quickly abandoned interest in clinical use.
Immediate negative effects of GHB use may include sweating, loss of consciousness, nausea, auditory and visual hallucinations, headaches, vomiting, exhaustion, amnesia, confusion, and clumsiness.
GHB overdose is common and frequently requires medical treatment. Patients may exhibit various degrees of consciousness depending on the dose taken and the time that has passed since GHB was last consumed. GHB overdose symptoms include dizziness and lightheaded, blurred vision, confusion, overwhelming sleepiness, stumbling, disorientation, nausea, vomiting, muscle spasms, just to name a few. Some people going through GHB withdrawal experience psychotic thinking characterized by profound disorientation, paranoia, hallucinations, and delirium. In some cases, GHB withdrawal has proved deadly. Overcoming a GHB addiction can be as difficult as kicking a heroin addiction. Little information is available on treatment options for people addicted to any club drug, including GHB.
Long-term frequent use of GHB causes changes to the brain's neurochemistry, much in the same way that alcohol and benzodiazepines do. While GHB slows brain activity, the brain becomes accustomed to the drug over time and compensates for its effects. Some users of GHB are not physically dependent upon it and can be treated and informed on an outpatient basis. So chronic use may result in severe withdrawal symptoms upon detoxification, and close medical supervision and supportive care is required for these patients. As far as hospitalization, that may range from 7 to 14 days. Addiction to GHB can be daunting, and there may seem like there is no hope of recovery for one who is in the trenches of their dependence, but it is important to know that there is hope for recovery. That wraps it up for the GHB presentation. Thank you so much for watching and listening. I hope you found this helpful. If you have any questions, please feel free to contact me at lizette.yerenas@laverne.edu. Thank you so much.